Hi, my name is Dr. Todd Austin, and I'd like to welcome you to the Dr. Todd Show. Today on the show, my guest is one of my clinical nutrition mentors, Dr. Brian Reid from Maryville, Illinois.
Hi, Dr. Todd.
Thank you for
Great
joining
to be
me.
back.
Yes, it's good to have you back. And today we're going to talk about a subject that is close to me because my wife, for those of you that know, she is a gluten-free blogger, and her name is her handle, I guess, is gluten-free Gina, hashtag gluten-free Gina. So we're going to talk about gluten today. And so my first question for you, Dr. Reid, is what is gluten and how is it bad for us?
Well, gluten is a storage protein that is found in the endosperm of all seeds of grass or grains. And that is the part of that they mill the seeds that is used in all of our baking processes. This is why we love wheat products so much. It gives it the nice texture and the chewiness in our foods. The problem with gluten is that it can be very damaging to our gut wall. And when that happens, it's very sticky. It's a very sticky protein. Gluten actually comes from the Latin meaning glue.
Exactly.
And it literally will bind to the wall of the intestine, and it'll separate the tissues there, and it will cause the gluten to actually leak into the blood supply, or other food substances can also bypass into the blood. And when it gets into the body, it can then cross-react with other tissues. Other tissues and other organs, such as it can affect the brain, it can affect the thyroid gland, the pancreas, it gets into your skin, it can cause skin disorders. So there are a whole host of, a whole number, I should say, of complications that can come from eating gluten.
It doesn't sound like a pretty picture.
No, it isn't. And gluten sensitivity is the problem, is what is caused by this. And gluten sensitivity is responsible for over 200 medical conditions or diseases.
Wow.
And we know one of them, which is the most studied, and that's celiac disease. Celiac disease is actually one of those 200 disorders that gluten sensitivity can cause.
Okay. Now, you mentioned celiac briefly, you mentioned gluten sensitivity, but there are also such things as gluten allergies or gluten intolerances. Can you explain those?
Okay, the first would be a gluten allergy. An allergy no different than people who are allergic to bee venom or allergic to peanuts, or people that have seasonal allergies. It's going to be an immediate response when they're exposed to that agent. They may come down with runny eyes, maybe difficulty breathing. They may break out in hives. The second would be a gluten intolerance. Intolerance does not involve an immune response from the body. It more or less is kind of like the body just doesn't like it. So you may have some gastrointestinal discomfort, maybe some bloating, gas, diarrhea is a good example of what you would experience with a food intolerance.
Okay.
And then the last would be gluten sensitivity. Gluten sensitivity is an immune response. It's delayed, unlike the allergy, which is immediate. You know if you're allergic to something that you're allergic to, because you'll have an immediate response to it. But unfortunately, with the gluten sensitivity, it can be a delayed response. So you can't always make that connection with the food that I ate and maybe some of the symptoms that I'm experiencing.
Exactly.
So the gluten sensitivity, there's over 200, like I mentioned, disorders, medical conditions that have been linked to gluten sensitivity. One of those being celiac disease. Celiac disease is it's really just kind of confined to the intestinal tract. People that have celiac disease experience bloating, gastrointestinal discomfort, maybe some blood in the stool. They also have malabsorption and digestion problems. But with gluten sensitivity, you will have a lot of the symptoms that people have will be extraintestinal, so these symptoms will occur in other parts of the body.
So another question that I have, Dr. Reid, is are there some different conditions that maybe have not responded to conventional medical treatments that could be caused by gluten sensitivity, in your opinion?
Yes, absolutely. If you're somebody who has been suffering for some time of migraine headaches, maybe hypothyroidism, maybe brain fog, dementia, depression, anxiety issues, maybe some skin conditions that just don't resolve on their own, or that you've been to multiple doctors, have tried multiple different kinds of therapies, and you found that you just have not gotten any relief, then you may want to consider addressing your diet and looking into the possibility that gluten may be the cause of these problems, because gluten sensitivity is different for everybody. And again, if you have that genetic component, then you really need to get to the bottom of it fast, or else it's just going to lead to more problems down the road.
Okay, and speaking of the skin, I have a family member, and if she eats a lot of gluten, she has a lot of skin issues with her feet, especially in the wintertime, like they crack all the time.
Is that right? Okay.
But if she stays off of the gluten, her feet do real well in the wintertime. They don't crack, and the skin is a lot smoother, so it's really like night and day.
Interesting.
So it's something, it's something that most people would not associate that with gluten, but in her case, it's very much related to gluten sensitivity.
Absolutely. You just never know what you're going to deal with gluten sensitivity, but the gold standard way to know for sure is to have that genetic testing done.
Okay. All right. And so thank you for joining me on the show again, Dr. Reid, with a wealth of great information about gluten.
Okay. Anytime. Happy to do it.